of Zoom. I think we're live, so I'm going to say welcome to Doc Talk Live. Welcome. I'm with Adam Miller of Algos. Is that right, Adam?
Yes, sir.
I appreciate you joining me today. So go ahead and ask your question, Adam.
I said before we logged on, I said, what can I do to make sure that I'm the best guest I can be to help this be the most productive show it can be?
So my answer to that would be, you have a product, and I assume that you're quite passionate about it. And so I think the best thing you can do is just share your passion about what you're trying to do. And I think that will help our viewers, whenever they may be, get an idea of this. So just start with a little history. Who are you? What is Algos?
Sure. My name is Adam Miller. I'm started my career in medical in about 2010. I originally started as a member of industry with medical devices, originally with the Aquamanus device, which is used for blood control during spine and orthopedic and trauma procedures, and started to get a flavor for the clinical side of business. I had historically been in other areas of business and sales, and that was my first foray into the medical space. And just like most people who are probably watching this, once I got into that world, I was sort of hooked. And over the last 10 years, I've built several businesses trying to make and find opportunities for synergies between industry and medical professionals. And I've been fortunate and successful with, for example, leveraging medical education as a method of physicians helping to position themselves within a market, working with companies to help find physicians that share their passion for the sort of innovation that they want to bring to market and things of that nature. So through those travels, I've sort of developed a little bit of a reputation as somebody who can help get things done. So Dr. Tochik is a pain management physician in Rapid City Medical Center up in Rapid City, South Dakota. And he actually came to me and said, "Hey, Adam, I've got this problem that I need solved, and I can't seem to solve it on my own." And he said, as a pain management physician, it's really important to me that I'm able to demonstrate to patients, payers, and providers that the interventions that I'm providing have a functional benefit. So I can actually show people that what I do helps. And short of hiring a research coordinator and, treating this like he's back at, Carolina Pain when he was in his fellowship, short of having those sort of resources, he wasn't sure how he could reasonably capture patient-reported outcomes and engage patients in that way. And he asked if I would help him find a digital tool or create a digital tool to do that. And so I connected him with a local web developer that have their own in-house developers. It's a pretty sophisticated company. And I said, hey, if this guy wants to have this built, what would that cost and how would that go? And they said, we like this idea so much, we'd actually like to partner with you on it and start this as a company. And so we became a software as a service company under them called Algos Pathways.
I love that name, by the way, Algos. So it's just sort of a spin on the word pain.
Exactly.
And so you've created a software to allow providers like myself sort of track patients' function, correct?
That's exactly right.
So I'm the utilizer, right? I would be the utilizer of this product.
Actually, no. One of the most important things was that in no way, shape, or form was there any trauma to the patient, the existing physician workflow. So what this is it's a product that digitizes all of your existing paperwork and then serves that to patients via text links that makes it so that they can complete patient paperwork prior to showing up. They can complete PROs, identify on a pain map where they hurt. So for example.
But what I'm saying is who is buying your product? I'm assuming it's people like me.
Yes.
Are buying this product to have this data accessible so I can then use it to justify what patients may or may not need. Do I have it?
Yeah, exactly. You'll buy this product for that.
So sell me on the product, Adam. Why should I buy your product?
Sure. Well, I think chief reason among it is that every year providers are asked with increasing scrutiny to defend the procedures and the interventions that they choose for patients. And collecting objective-based data to demonstrate the efficacy of not only the interventions, but yourself as a practitioner used to be a nice to have. And I quickly believe that with a combination of more stringent commercial payer policies and the rise of healthcare consumerism, that it's no longer a nice to have, it's a have to have.
Okay. So show me how it works.
Sure.
How do I integrate this into my practice?
Great question. So one way is the way our product works is we automatically interface with your EMR. So we work directly with your EMR provider, whether that's Epic or .chrono.
We use eRecord. Have you heard of them?
I actually have not.
xScribe is another name for it. Have you heard of xScribe?
I have.
Okay. So we use xScribe. Okay.
So what we do is we partner with your EMR to basically connect the plumbing between your scheduling functions, your diagnosis and treatment functions, and the Algos system. So each time a patient visits, we know how the patient said that they felt when they completed a patient-reported outcome relative to the part of their anatomy that they came in with primary complaint. We know what you did to them as a physician. We know what your diagnosis was. We know what your treatment plan was. And then we corroborate or overlay those two things to create a longitudinal data point demonstrating from index to discharge that patient's journey through their amelioration of pain.
Okay. Now you mentioned that you sort of like we have, what's it called? The scheduling piece. It's like Centricity. We have Centricity and we have xScribe. And these two devices really don't communicate very well together. So do you all integrate them or what happens there?
Yeah, typically in the digital world, it's called a source of truth. There is one source of truth. There's one location where all data, that's it. Everyone benchmarks off of that individual piece of data. Typically what I've seen is there'll be practice management tools or scheduling tools like you're discussing, but the scheduling function will be performed through the Centricity, but it always comes back to the EMR because it has to for billing purposes. They have to know when you were there. So
can you like share a screen and show me what some of this stuff looks like?
Absolutely, sure. I'm gonna pull that up right now. Give me 1 second and I will do so. So if you'll take a moment to make me the host.
Oh, sorry.
No,
I'm so bad at this Zoom stuff.
No, that's okay. I think we're all learning.
Figure this out here. So share screen. No, I don't want to share my screen. X. Participants. No. It just says I can invite you. How do I make you the host?
On the right-hand side of the screen, typically you'll have a spot where it'll have my name, and then you'll be able to right-click my name, and then you'll be able to make me the host.
Got it. Make host. Yes. You're the host.
All right.
Welcome to Doc Talk Live, Adam.
That's right.
Taking over my Facebook. Oh, great. I'm seeing it.
Good deal. All right. So this is I've got the live software platform, but I feel like these images are better because I can actually show you the patient facing app. So part of it is each practice gets their own app that has their own logos, their own review centers, all tied to it. So there's a bit more to it than just the dashboard, which I'm showing you now. But this is the back-end dashboard where you'll see a list of the patients that are scheduled for each independent day. Again, as a provider, you don't need to interface with Algos on a daily basis. It's all automatic and runs in the back. The only person who's going to be inputting information into Algos is going to be the patient, and that's going to be the patient reported outcome that they complete. So for example, if they completed an ODI, it would go to Algos. We would get the information about the diagnosis and treatment plan, the CPT codes, the scheduling data. All of that would come from the EMR that you were already putting in. But one of the features about this that I think is really powerful is that you're basically running a study on all of your patients automatically at that point, because every patient is providing objective-based data that is benchmarkable relative to the studies that you see run more broadly in their respective journals. This feature here, for example, allows you to export in a .csv or basically an Excel file patients based not only on their outcomes, but also on social determinants. So one of the big challenges in data is making data clean. It's easy when you have a big text box, that's called dirty data. It's hard to discern exactly what all of that is because it's in a text box that's free floating. But when you digitize your new patient paperwork like we do, what you're able to do is you're able to make discrete questions like psychiatric status about anxiety or depression. You're able to make discrete things like payer status and current status of a relative lawsuit. All of these things play a part in the patient's secondary gain or motivations, and those show up in outcomes. So we're big believers that it's not just about the objective functional score, but also understanding more about the patient. And that's what we think is really nice about this tool, is the ability to tease all that out by making this data.
So let me fast forward a little bit. Let's say I'm seeing, patients, thousands of patients, okay? And now I've got Algos, okay? How does that look for me? I mean, what information is Algos going to give me?
Great question. Every day when you see patients, you internally make calculations about the sort of outcome, and I'm being assumptive here, so please correct me if I'm wrong. But when you walk into a room, you already have a set of expectations about how a patient is likely to respond to a treatment. And that's sort of that's sort of an instinctual analog thing that you do. Correct. And you do so based on your learned experience and behavior with patients relative to their outcomes. And what this does is it actually objectifies that and puts that in one repository that you're able to actually manipulate. So you're able to actually go into cohorts of data. And here's great, perfect, right on time. So you're able to filter data for all of your patients based on whatever cohort you're interested in. So for example, if I just wanted to look at patients who presented with SI joint pain, I'd be able to say, I want to see patients that saw me for no longer than 5 visits, that were ages between 40 and 60, that had a primary presentation VAS score of 7. And you can tease all of this out, and you can see how each of those patients actually performs. Now, what's powerful about that is that you can share this with patients, payers, and other providers. So for example, with other providers, why would they be interested in that? For 3 months, you're able to get patients from, let's say, a Dr. Tochik, and he's a referring physician that you value. You'd be able to use our system to have a one-pager that would print up all of the patients that he has sent you over the last 3 months. And you'd be able to say, Dr. Tochik, thank you very much for trusting us with your patients. I wanted to give you a little scorecard to show you how I'm doing with the patients you send me. On average, they have a primary pain presentation of 7 when they come to my office. Of the 30 patients you've sent me in the last 3 months, I've successfully discharged 20 of them from my practice in less than 3 visits. Of the remaining, we're seeing this amount of functional improvement. It's a communication tool that I think physicians are so used to speaking to each other in EMR that it really sort of breaks that mold for a provider to not only have a conversation with their peer about the outcomes for patients that they're sharing, but also to demonstrate a depth of concern or a depth of knowledge that would leave that referring provider to think, geez, this guy is on another level.
So for instance, I do a procedure, I do some minimally invasive procedures. Superion and Minutemen are 2 examples of such. And Intercept is another one. So there's sort of procedures that are above and beyond just simple pain blocks. And what you're saying is I could aggregate that data and say, I've done 100 Superions. This is how they look before the procedure. this is how they're after the procedure, or this is, I could get sort of almost research quality data. Is that what you're saying?
Yes. And moreover, as a provider, Relievant or or Spinal Simplicity, a company would be clamoring to collaborate with you for study collection because you would already be doing it to the standard and expectation that they would hope. You would be a turnkey study solution.
So let me give you another example of something that I would personally be interested in. So I played tennis in college. I love to play sports. I still play hockey. I think in terms of sports a lot of times, and my goal when I see a patient is to see them as little as possible and do as little as possible. In other words, the more I do for the patient, the worse job I've done. And the less I do,
right,
the better job I've done. Sometimes I compare myself to a hairdresser. If you've got gray hair and you go there and you're just covering up a problem, putting some hair color in there, if you have to go to the hairdresser every week to get your hair colored, maybe you need a different solution, right?
Right.
And so, I guess the question in my mind is how am I doing relative to the rest of the world? Because theoretically, patients are seeing this. I mean, providers are seeing the same patients I am, but their pathway may be a little different. Their pathway may be to block the facets first and then do radio frequency before they even consider Relievant, as an example.
Mm-hmm.
You follow me?
Yeah.
So can the Algos be used almost as a comparator with your other practices, I guess?
For a sports analogy, this is a scoreboard.
Yes.
Don't guess how I've done. Let me show you how I've done.
Yeah. But can I use the scoreboard to compare to other Algos practices?
That's something that we have the ability to collect, and we could do that, and we absolutely can do that. That's just something that we're going to ask each provider as an individual. All the data that's collected is de-identified in every way, shape, and form. So there's no way to trace back who's doing better or what.
Because is it Dr. Platchek or Tatchek?
Tatchek.
Tatchek. If we are essentially seeing the same patients, and he's only seeing them 3 times before he discharges them, and they're at this level, and I'm seeing them 7 times, then I need to know what he's doing. You follow me?
100%.
He must be doing something right relative to me because of the data. So that would be something that would, make me very curious.
Yeah, that's something that we can do. We haven't yet integrated that feature, but we have that data, and we also want to ask each physician to participate that would be participating. I'd want them to sign off and say, yeah, even though it's anonymous, this is something that I want this comparison tool. You won't know it's Dr. Tatchek. You won't know it's Dr. Giafrida. You won't know who it is, but you will know that somebody else is treating patients in this algorithm with this primary presentation and this sort of social determinants and getting that outcome through this pathway rather than that. And that's leading to that outcome.
How much does it cost?
It costs a very nominal amount, but it's specific to every single practice. So it's charged on a per patient basis, and it's also per active patient. So you're only charged for patients that you're actively seeing. So for example, if you saw a patient twice, you did an injection, you saw them twice in 1 month, you'd only be charged for that 1 month for that patient. If you discharged a patient from your practice after seeing them for 3 consecutive months, you'd only pay for the 3 months where the patient was on. You keep the data, so you'll still have the ability, if the patient visits your practice in the future, to have that data as benchmark data, but you're not charged for any patients that aren't active.
So okay, here's sort of the problem. If my plate is full, let's say, okay, and I'm not actively seeking new patients, I'm not actively trying to prove to my referring doctors that they need to send me their patients, then my concern is this is an added expense which doesn't necessarily change my collections.
Well, there's a couple ways that I think it does impact collections, and let me share those with you. I think first, it provides, one of the things about the app that we really think is a big deal is it provides a digital pathway for patient engagement between the physician and the patient's personal journey. So inside of the app that each practice gets that works with us, you have the ability to, obviously that patient can track all of their own progress. So you'll have a digital pain journal. They'll have access to independent benchmarking about how much better or worse they're physically doing with their function. I think you've been in the room plenty of times where you ask them what their pain is and it's always a 7, right? And it's the same thing with this. Using an independent benchmark tool like this, you're able to say, well, you may say you're still at a 7, but it looks like your functional disability has decreased 22% since the last time I saw you. You're doing a lot better. And for some pain patients, having that external benchmark is a big deal. But as it relates to collections and improving practice health, I think the biggest opportunity for a physician is with the Google review and the social media and the ability to share patient outcomes. So inside of the app, we automatically directly tie the API of your specific review. So let's pretend you're interested in Google or you're interested in vitals or whatever it may be. We tie that directly into the app so that a patient is able to click on your preferred method of review and leave you a review to let other patients know that they've had a really positive experience with you as a provider. And that in and of itself is a way to help build, develop, and differentiate your practice because of the healthcare consumerism that I mentioned.
Right. And again, if you're trying to build a practice, that would be huge, right?
Yes, it would be. But I think if the supposition is, I'm so big and so successful that I don't need to innovate, I think that almost beg, why does Herman Miller continue to produce a chair? They've got the most comfortable chair, but every year they come out with a new chair. And it's because if you're not willing to disrupt yourself, some new entrant will. And so as whether you're running a business selling chairs or you're making the finest automobile or you're providing the best legal services or you're providing the best healthcare in the world, it's incumbent upon you as a business owner, because it's easy to forget that we're all salesmen, all of us, and we're all trying to build, we're all business owners, a lot of physicians. And if you stop innovating and you stop investing in your business and you stop doing the things that got you where you are, then some other person will come and happily take that from you. Yeah. So I think there's a pressure on you to sort of keep up and push yourself because you're in competition.
And I guess I hear what you're saying, and I tend to push myself in areas of technology. This is a technology, okay? Mm-hmm. I tend to push myself in areas of technology that affect patient care, whereas this is something that is just evaluating the care that's being provided, which believe me, I think is great. I would love to have that information in order to not market my practice, but to evaluate what I'm doing. But again, I want to compare myself to my colleagues so I can really have a better grasp of what works for people and what doesn't. Like you said earlier, all I have is a grasp of what I think is working based on my own experience with my own patients. And it's not quantifiable. It's just a quality metric, it's a text box, as you would call it. I have a text box awareness of what works and what doesn't. So I do tend to push myself to be on the cutting edge of delivering technologies that are actually experienced by the patient or done to the patient, whether it's a biologic like a stem cell or a intervention.
Well, it sounds like your practice is very busy And because to your point, you've mentioned you're at capacity. So is it fair to say that efficiency is an important part of your experience on a daily basis?
Yes, efficiency is huge, Adam.
Okay. So
Huge.
let me share with you one way Algos impacts efficiency. So each individual patient, based on the CPT code and ICD-10 codes that you assign to them, is enrolled in a specific pathway. So for example, let's say that you scheduled a patient for a new appointment. They get an appointment reminder at whatever discretion you want, 24 hours before, 2 hours before. You want to send them a text reminder about not forgetting to bring their MRI. You can send a text reminder at whatever interval you want. You book that patient for a procedure. Let's say it's a cervical TFE. They don't know any better. They just think it's a little injection. But in the EMR record, we see that that patient's on blood thinners. We can send them a message at 7 days out if they're on one, or 3 days out if they're on the other, and say, hey, you have an injection coming up in 3 days. Have you stopped your blood thinner? Hey, you have a procedure in the morning. You've got a Minuteman in the morning. Don't forget, you can only eat for 1 more hour. I look forward to seeing you in the morning, doc. So by sending, I think one of the biggest eye openers for me as a patient, my wife had surgery, and when you're taking care of somebody and you're so overwhelmed with the status of your spouse or your loved one who's going through a procedure that it sort of all washes over you, all those physician directions, and you're given a binder or a folder,
right,
rules to follow. And what Algos does is it actually sends the patient the message they need to get at the timing they need to get it, so that they can remain compliant and not have to worry about, well, you know what, let me check the folder to see how many milligrams of Tylenol I should have taken today. Right?
Is there something called synchronous and asynchronous video? Have you heard of something like that? I showed Algos to a friend of mine who is in the what's it called? The world of doing digital medical type thing, like telehealth.
Right.
And so what you're describing is really a telehealth platform to allow patients and providers to be more integrated. We
do offer asynchronous videos. So as you can see on this product image here, you've got a videos tab inside of the app that a patient is able to click on to see things like meet the doctor, or let's say, for example, they've chosen, or you've chosen as a provider that they would benefit from a relievant procedure. They would then be served a video about what to expect. When you wake up, don't forget, you're not going to know what the outcome is until 6 weeks, right? It's going to be, you can do expectations setting. You can send the patient a list of perioperative do's and don'ts about the way they should think about their procedure, about don't forget to change your sheets the night before, take your Hibiclens bath, whatever direction you want to provide those patients. So this asynchronous video is very useful as a method of being able to engage patients in an audiovisual way about their upcoming procedure or interaction with you as a provider. So we do feature that.
Well, I've enjoyed talking to you, Adam. You've answered all my questions, and I think this technology is very exciting. I don't know, just right now how to, I'm in a practice with 10 people, but I do like the idea of trying to integrate this into a practice like mine. So hopefully we will continue to interface about this.
Yeah, and I'd love to hear more about your thoughts about what elements of this you would value as a provider who's at that ultimate end of the spectrum, right? There's not a lot of providers that are at that position where they have such thriving practices that they're looking for this is built for the practice that's really in that competitive market, that's saying to themselves, what do I need to do to stand out? What do I need to do to take my practice to 11? What do I need to do to help shift my patient demographics to the educated, motivated, high yield patient who's going to come in with a specific problem looking for a specific solution.
Yeah.
And so I appreciate the opportunity to speak with you today. And I appreciate the opportunity to learn more about how Algos could serve a practice like yours.
Yeah. And I'm hoping that this video can be helpful to, the people that do what we do, that could say, this is exactly what I want. This is what I need to integrate into my practice. But I certainly see how I would appreciate the data, which is to say, it's like a scorecard. It's like a scoreboard. But I would need to be competing with somebody else. I would need to see their scorecard, like in golf. I mean, it's one thing just to say, hey, I shot this, but I need to look at everybody else's scorecard to see what they shot.
Absolutely. I understand that for sure.
All right, Adam, I appreciate it. So am I the host now, or are you still the host?
Oh, I think I'm still the host.
Okay.
I wish you'd made me co-host. You've really done it this time. So here you go. You're now the host.
All right.
2, 1. There you go.
See, so I'm wondering how we end this. Oh, it says I'm the host now. So now I can end our Doc Talk, our Zoom. Adam, thank you so much. So Adam Miller, everybody, with Algos. I'll get Christy to put up all the links and stuff like that. And it was a pleasure to meet you.
You as well. Thank you, Dr. Goodman. I appreciate it very much.
Oh, thank you.